So what we are going to do today is I'm going to take you through how I examine a patient. This is an employee, Bailey, and I've never actually asked her anything about her pain or anything going on. So we're going to see just by her movement patterns and what I find without even asking her anything. And so I'm going to take you through a step-by-step process of how I evaluate and actually treat a patient. And normally I would have asked them all sorts of questions, but I'm going to do this just to see if I find what validates what she says. And so I'm going to have you, first off, we're always looking for the ability of the body to expand upward and outward in the gait position. And so everything that I do is going to be looking for the ability of her body to rotate properly. So I want you, first, I'm going to skip a few parts, but I'm going to have her lay face down on the table. So go ahead and lay face down, Bailey. Let me take these glasses for you. There we go. Okay. So I want you, one of the primary things I do is I want to see what the hip extension looks like. Raise your right leg up as high as you can go. Bring it down. Raise your left leg up for me. High as you can go. Is there any pain there? Does it seem hard to do? Not really? Not hard to do either? Okay, so now I'm going to have you raise your right leg up for me. Hold it right there. Hold it. Hold it hard as you can. Okay, raise your left leg up. Hold it as hard as you can. Okay, so this is the biggest muscle in the body, and we want this to be very strong. She's got a little bit of weakness there. So we don't know where that's coming from. I'm just going to look at something here, Bailey. I'm going to look at the tightness in your calf muscle here, and you tell me if this is tender here. Okay, we're going, this is the spring that is really important for that gluteal muscle. I'm just rolling out this spring here, and we're going to do it on both sides here. You feel that, Bailey? Okay. Okay, raise your right leg up as high as you can go. Hold it, hold it. Okay, raise your left leg up for me. Hold it. That made a difference. So now I'm going to look at tightness in through here, and I'm going to just go into this glute. Does this feel tight, Bailey?
A little bit.
Okay, we're just looking for the ability of the body to counter-rotate here. Do you feel that stretch, Bailey? Does that feel good? Okay. She has some tightness in her quadratus lumborum. In her lower. Do you feel that when I push down, Bailey? Do you feel tightness here? Do you ever get knee problems at all?
Yeah.
Okay. She has a very tight IT band, which is very common, and it is pulling her knee a lot. Is the pain on the inside of your knee mostly? Yeah. So when we see this type of tightness, it's almost always going to drive that knee inward. So we need to really lengthen this band right here. And she has a lot of pulling weight. Do you feel that, Bailey? Do your feet hurt you sometimes?
A little bit.
Okay, so that is really tight there. Okay, you can feel that, right? Okay. So we're going to look this way. If you want to come over there, just like that. And the same thing here. You feel that, Bailey? Which knee is worse on you? Or both the same?
Probably this one.
So we're looking now at some of the rotational change. So I want you to lay on your right hand side, okay?
That's my left.
Yeah, that's right. Bring your right shoulder behind you, Bailey. Right shoulder. Good. This arm forward. This leg way back there. This knee way up. Now, if you notice, this is the running position. And so we're going to look at muscles that create restriction in this position. Is that tender right there, Bailey? So her quadratus lumborum is really tight here, along with her oblique muscles. Feel that, Bailey? And my guess is this rhomboid here is going to be really tight. That tight right there, Bailey?
Yeah.
Okay. Do you get some neck and shoulder pain? Yeah. Well, I could really tell. So her ability to rotate in this rotational position is really compromised up here. And that's really tight there, isn't it, Bailey? You get headaches, don't you?
Yeah.
So upper cervical dysfunction is very much associated with headaches. She has overdominance of her upper thoracic and cervical extensor system here. And does this feel like a stretch to that right hip, Bailey?
Mm-hmm.
Okay, I'm gonna just really stretch that out there for me. Feel that stretch there, Bailey?
Mm-hmm.
Good. Okay, so we've got a lot of restriction on this side. Bring the shoulder forward here and bring this leg forward now. So this is the gait position in the opposite direction, okay? We're gonna look up here, and upper cervical dysfunction is associated with a lot of disorders, from vertigo to headaches to neck pain. It creates blood flow restriction problems up into the brain. It can create waste product drainage issues so that the brain can't drain its waste products very well. Is that tender right here?
Mm-hmm.
Rich in proprioceptors, meaning that it feeds in a lot of information to her nervous system. Feel that stretch there, Bailey?
Mm-hmm.
She has a lot of restriction for her scapula. Remember, I've never seen her before, okay? So, just seeing if what I am finding validates what she has. Do your hips hurt you sometimes?
Yeah.
Okay, there's a lot of congestion in her gluteal muscle here. This is the typical position that we see when you go to a chiropractor. So a lot of times when you go to the chiropractor, you know, he's adjusting you this way. We're just taking it slower, and we're working on the fascia here. This is what I call my expansion method of chiropractic. I do a lot of expansion stretching, a lot of, this is a form of adjusting, and it is a low velocity form of adjusting. Feel that stretch right there? Okay, does this feel good?
Mm-hmm.
In a strange way. Okay, let's go on the other side. Left shoulder behind you on the other side. There we go. This arm way forward like this, and tender right here, isn't it?
Mm-hmm.
Okay, bring this knee way up there like this. Do you feel that stretch on this side here?
Mm-hmm.
Does that feel good?
Yeah.
And that tender right there?
Mm-hmm.
Is it not as tender as the other side, or about the same?
About the same.
Okay, and upper thoracic rhomboid dysfunction, pretty good here. Feel that right there?
Mm-hmm.
Okay, now I want you to bring this leg forward and the shoulder forward here again. There we go. Yeah. Okay, so now lie on your back for me right now. I think we already did that there before. So lie on your back. Bring your arms way up over your head for me. We're going to look at her diaphragm. Feel that stretch right there? Okay. A lot of people do not breathe correctly, and their diaphragm does not work. I have not evaluated her for that, but I wouldn't be surprised. Feel that stretch there? Okay. And the scapula on her system is very restricted here. This is the subscapularis muscle we're releasing here. Okay. Bring your arms down for me. Okay. Now turn your head that way for me. And that's really tight there, isn't it?
Mm-hmm.
Okay. So this is the upper cervical dysfunction again that we saw before, and we're just treating it a different way. Feel the stretch?
Mm-hmm.
Okay, now turn your head the other way for me. Okay, good. This is a form of stretching and adjusting. And feel the stretch there? Okay, feel that here?
Mm-hmm.
Okay. Now, we're going to look at one more muscle on this chain. Come way down to the very tip of the table, facing that direction there for me. Way down. And you go over there and lie on your back and bring this knee up to your chest. This one. Okay, hold it right there. And I'm going to check the psoas to see. That's a little tight there, isn't it? Okay. This can contribute a lot to poor hip extension and lower back pain. Feel that right there?
Yeah.
Okay, bring this one up like this. Okay. And bring it way up there. Good. Feel that?
Mm-hmm.
Okay. Okay, so now lie face down for me. Step way up there. Okay, now raise up your right leg so far. Hold it there, hold it. Hugely different. Raise this one up for me. Hold it. Okay, good. Feels different, doesn't it?
Mm-hmm.
Okay, now, why don't you go over there, and why don't you sit up facing that direction for me? And, okay, so why don't you face over here, so,
Me?
no, you go over there for me, okay? So, sit up nice and straight for me. And so what I'm gonna do right now is we're gonna look at this vertical posterior chain. And we're going to see if she can maintain a lordotic curve. Arch your back with your knees down and your feet up towards you. Does that feel hard to do? Not too bad? Okay. So twist to the right for me. Is that tender right here? Okay. So she has a lot of deep extensor tightness here, and we're going to work on the mobility in this area. Tight there, isn't it? Okay. And she has a lot of congestion down here in her hips. Twist to your left for me. Is that tender right there? Tender right here. Okay, look straight ahead there for me. Tender here.
Yeah.
She has a lot of strain all the way up through. And we go up into the mid back here. That tender. A lot of times I will do a manual adjustment, which you think of when you're going to the chiropractor into this area with this type of problem. That tender? Okay. Pretty sore up there, isn't it? Okay. You always feel a lot of tightness up and through this area?
Yeah.
Okay. So she has an imbalance where she's got a significant amount of overactivity of their upper traps and weakness in her lower traps. We call this an upper cross syndrome. This is very tight here. So the equation is that we want to lengthen this posterior cervical area, and we want to strengthen the neck flexors on the front side. And so we do a whole system of lengthening these muscles. Now I'm going to have you come over here to this stool. So why don't you go over there now again for me. And you're going to sit. You can just kind of sit that way like that. So we're going to work up in through here. Tip your head down and to the right for me. We're going to lengthen this upper trapezius muscle. Feel that stretch right there? Does that feel good? Okay. We're going to get this muscle long, lengthened here, and she's got a lot of stress, tightness to the levator scapula muscle. That's tight, isn't it? And her rhomboid that pulls up into her neck all the time. And turn your head this way and tip it this way, and I'm just going to work on the joints. This is a form of adjusting, and it is a form of stretching. Feel that right there? Does this feel good in a strange way? Okay, turn this way for me. Right there. Feel that stretch? Okay. Way down there like that. Feel the stretch? Feel that stretch?
Yeah.
Okay. Feel the stretch here? So I'm adjusting and I'm lengthening tissue so that she could have better vertical expansion. Look straight ahead for me. Turn your head to the left and now to the right. Look straight ahead for me. And I'm going to pull it this way. That tender right there. And this way. Okay. Good. Now, stand up there for me and just kind of walk around. Tell me how that feels so far.
Better.
Okay. Do you feel taller? Okay.
Yeah.
Do you feel more straight? Like your body's a little bit more supple? Okay. So I've never seen her before, but she has a lot to work on. Most people have a lot of issues of imbalance in their body, a lot of strain. And so when we treat both expansion stretching and expansion adjusting, we try to then reinforce it with teaching her how to treat it with lacrosse balls. I make tools and then I want to reinforce it with exercises. We want to get that deep stabilizing system activated so that her deepest core is working very well, and the outer muscles are not having to then react and adapt, because she's got a lot of tightness in her lumbosacral system, weakness in her glutes, weakness in her neck flexors, a lot of tightness up and through here, and it inhibits her ability to expand upward and outward in the counter-rotated position. Everything we do is to try to get the body to be as vertical and to get out horizontal in these positions, and so that's my expansion, adjusting, and stretching procedure. On future videos, I will show the exercises and mobility procedures.